BMI Thornbury Hospital in Sheffield is part of BMI Healthcare, Britain's largest provider of independent healthcare. The hospital is home to the Thornbury Gamma Knife Centre and is one of only 6 gamma knife centres in the UK. Gamma knife treatment is a high-quality, non-invasive radiosurgical process that treats brain tumours and disorders. It offers a safe and effective treatment for more than 50,000 patients worldwide every year. The procedure is simple and straightforward. The gamma knife focuses beams of radiation on the affected area in the brain without damaging surrounding tissue. Despite the name, there's no knife involved. It gets its name because the beam targets the treatment area with such precision.
It is a form of radiation treatment with very high precision, treating a small volume within the brain. This is a treatment where, in the depth of the brain, we can operate without opening the head. Gamma knife treats a very wide range of conditions. It goes from tumors, benign and malignant, vessel malformations, particularly cavernomas these days, and even functional disorders like facial pain and, in some selected cases, epilepsy. Gamma knife treatment is very effective for the majority of conditions where we treat. We don't necessarily treat, for instance, in cancer, the whole patient. We just treat the brain. But there we are very effective. Over 90% local control rate can be achieved with the tumors that we treat. Even if the patient has 2, 3, 5, 10 tumors. In fact, we treated a patient with over 20 tumors successfully, every single one responding to the treatment.
Following a referral from your GP or consultant, you will have an initial outpatient appointment with one of our consultant neurosurgeons who will assess your suitability. If gamma knife is appropriate for you, you will be offered the next available date for treatment. The night before your treatment, you'll be admitted to Thornbury Hospital, and in the morning you will meet with your consultant and the team of radiographers who will be looking after you during the day. Your consultant will give you a local anaesthetic before fitting you with a special head frame. This frame holds your head in position so the gamma knife can target the right places. You will then have an MRI scan so the gamma knife team can put together your personalised treatment plan.
The treatment planning I do is specifically placing shots of radiation inside the target volume that we want to treat. We actually have 65,000 different combinations of the shape of the shot, the radiation sphere that we can deliver. So because of that, we can shape the dose around any shape tumour. That gives us incredible flexibility and versatility to match the radiation to the tumour, but spare areas of the brain that we don't want to treat.
Most gamma knife treatments last approximately an hour. You can listen to music if you wish, and you'll be able to talk to the team throughout the procedure. You can stop at any time if you need a break. When your treatment is finished, the frame will be removed and you'll return to your room for a couple of hours to relax with light refreshments before going home.
Recovery time is different from patient to patient. We often recommend that they have a couple of days just resting within themselves, but should they want to go back to anything, by all means they can get straight back into their daily life as soon as they want to. The patients themselves are really surprised on how each case goes and how they feel after the treatment. Obviously there's a lot of anxiety coming up to the treatment, and they're really surprised. All their worries are usually unfounded. They find it so much easier than they expected, and they're surprised they can just go home and see their family the afternoon afterwards feeling exactly the same as when they walked through the door.
I rang, left a message on Mr. Kemeny's phone, and he returned the call within hours, and we had quite a lengthy chat on the phone. He was very helpful and got me in straight away for a consultation. When I had the MRI, because the Thornbury equipment was a lot more sophisticated and refined, I found out I actually had 29, not 3, 4, 5, but I actually had 29 because this high-tech equipment could actually pick up the tiny little rogue cells. But we said, yes, let's go for it, and it was all over and done with within 3 weeks, probably from start to finish. if ever I have been worried or anxious about absolutely anything, I email him, and within hours I get a response, and I find that absolutely, the aftercare of that is second to none. All very human, and I couldn't really praise them enough.
If Gamma Knife is an appropriate treatment option for your condition, ask your GP or consultant for a referral to the Thornbury Gamma Knife Centre.